Welcome to the Clean Classrooms for Carolina Kids lead-based paint section training. I'm Lisa Green, the project director of the lead-based paint and asbestos sections. This program is a partnership between RTI International and the North Carolina Department of Health and Human Services, along with the North Carolina Department of Public Instruction as a liaison. Together with my colleagues, including Crystal Lee Powell-Jackson, we will overview how to participate in the lead-based paint section of the program. The goal of our program is to identify and eliminate lead and asbestos hazards where North Carolina children learn and play. We partner with public schools, licensed child care centers, and family child care homes to identify hazards, share results, and help facilities take action to ensure healthy learning environments for children. In this training video, we show you how to participate in the program and meet state requirements to identify and address potential lead-based paint hazards at your facility. We will briefly cover background on lead-based paint and overview the section and steps in the process. We will then discuss how to complete the lead-based paint enrollment survey and what happens next, including RTI's review of your documentation, potential next steps, including a lead-based paint risk assessment, and possible recommended actions based on each specific facility's conditions. After this video ends, you can complete the lead-based paint enrollment survey. Now, let's get into why we are focused on lead-based paint. First of all, what is lead-based paint and why is it found in some buildings? Lead is a naturally occurring metal that was previously added to paint for durability and appearance. Paint with high lead content is known as lead-based paint and was often used in buildings until it was banned in 1978. Lead-based paint can be present both inside and outside of buildings, including on doors, door frames, floors, walls, and windowsills. Some facilities may have already removed lead-based paint hazards from their buildings. Why does it matter if lead-based paint is in some buildings? While lead-based paint was used for durability, it can pose a public health concern when it is not safely managed. Deteriorating lead-based paint from wear and tear or renovations can cause paint chips and lead in dust to accumulate inside the building. Areas outside, like playgrounds, can also become contaminated when exterior lead-based paint flakes or peels and gets into the soil or mulch. Children can be exposed to lead by touching surfaces, hand-to-mouth behavior, or ingesting lead-based paint chips, lead dust, or lead-contaminated soil. When lead is absorbed into the body, it damages the brain and other vital organs. There is no safe level of lead exposure. Early childhood lead exposure can cause lifelong behavioral and cognitive deficits. Lead poisoning is preventable by eliminating exposure to lead hazards. Our goal is to mitigate potential health risks from lead-based paint hazards at every child care center and school across North Carolina. With your participation and support, we will protect the health of students and staff throughout the state. There are a few key areas of regulation that have helped to reduce exposure to lead-based paint in the United States. An initial rule was passed in 1971 that prohibited lead-based paint in some residential structures, which was strengthened in 1978 with a ban by the Consumer Product Safety Commission on all residential uses of lead-based paint. In 1996, the lead disclosure rule was passed that required the disclosure of known information on lead-based paint before the sale or lease of most housing built before 1978. Additionally, certification requirements were enacted in 1996 and 2008 that established requirements for properly training individuals conducting lead-based paint activities, such as inspections or abatement. More recently, regulations have been passed and proposed to lower the amounts of lead in settled dust that are considered a hazard during assessment and clearance. North Carolina also has state-level requirements to address lead-based paint in public schools and child care facilities. These rules were passed in April 2022 and require facilities to identify lead-based paint hazards through an on-site assessment by a certified lead risk assessor, or submit exemption documentation if all buildings at the facility were built after 1978 and no lead-based paint was used. Facilities must mitigate or restrict access to any identified hazards. As this is a legislatively mandated effort to address lead-based paint hazards at public schools and child care facilities, North Carolina facilities are required by law to make sure all requirements are met. I'll now pass it over to Crystal, who will begin with an overview of the lead-based paint section of this program.
Thanks, Lisa. Now that we've reviewed the importance of identifying lead-based paint hazards, we can walk through how to complete the lead-based paint section of the program. To begin, the overall goal of this section is to identify and eliminate exposure to lead-based paint hazards at public schools and childcare facilities. For facilities that require an assessment, we will coordinate an on-site visit by a certified lead risk assessor. If hazards are identified, facilities can request reimbursement from North Carolina Department of Health and Human Services if they decide to perform mitigation activities. We encourage you to communicate with your community regarding your progress through the program. We will overview our communication toolkit later in this training that makes it easy to update staff, parents, caregivers, and students on the program. We're going to quickly overview the lead-based paint section steps, and then we'll cover each one in more details throughout this training. The first step was attending the pre-enrollment webinar to learn about the Clean Classroom for Carolina Kids program. And this step is completed. Following this training video, the primary contact will be ready to complete the enrollment survey and upload necessary documents. Our team will review the enrollment survey responses to determine next steps for your facility. If we determine that a lead-based paint on-site visit is needed, our program will then assign a certified lead risk assessor for your facility. The certified lead risk assessor will schedule the on-site visit with your facility and will conduct their on-site visit, including sampling, if needed. Any samples collected will be analyzed at our laboratory. Once results and recommended next steps are available, you'll be notified by email that they are ready for you to review in the online portal. Facility administration should notify parents, staff, and students of the results using resources provided by our program. If any lead-based paint hazards are identified, the facility must restrict access to those areas or choose to mitigate based on the recommended response actions provided by the certified lead risk assessor. If any mitigation activities are conducted, facilities can request reimbursement from the North Carolina Department of Health and Human Services, or NCDHHS. Now let's talk more about the who, what, why, when, where, and how of the lead-based paint section of the program. Your facility should designate a primary contact to complete the survey and be the main point of contact for the lead-based paint section of the program. Additional individuals can help to complete the enrollment survey if needed. In order to access the enrollment survey, you must complete this training. The primary contact should be familiar with any lead-based paint assessment that have already been conducted at your facility. The primary contact should also be familiar with the facility construction records, including past and planned building renovations. Additionally, if lead-based paint hazards are identified in your facility, the primary contact should be able to oversee the efforts to restrict access to or mitigate those hazards. To complete the lead-based paint section enrollment survey, the primary contact will need information on your facility, such as when it was built, student demographics, previous assessment details, any concerns about exposure, past and planned building renovations, and exemption documentation if applicable. Exemption documentation must be submitted to RTI for a facility to be eligible for an exemption from an on-site assessment. Facilities that were built after 1978 may be exempt if the superintendent or superintendent's designee can sign an attestation that no lead-based paint was used in the buildings. Facilities may also be exempt if they provide documentation of a lead risk assessment conducted within the past 3 years. Additional documentation may be requested to verify the prior assessment meets the rule requirements and any identified hazards have been addressed. It is important that documentation is submitted to the program because this is a state-mandated effort to digitize lead and asbestos records and make them easily accessible in a public document repository. If your facility is not exempt, an on-site visit will be required. You will be notified when a certified lead risk assessor is assigned to your facility. Soon after being assigned, the risk assessor will contact your facility to schedule the visit at a day and time that works for everyone. We estimate that the on-site visit is expected to last 1 to 3 days, depending on facility size. During the on-site visit, the certified lead risk assessor may assess the interior and exterior of your buildings for lead-based paint hazards, including paint, dust, and soil. The risk assessor will likely use a portable XRF instrument to identify lead concentrations in real time and collect samples as needed. In general, lead sampling is non-destructive but may cause minor damage to sampled materials. To prepare for the on-site visit, the primary contact should plan to meet the certified lead risk assessor when they arrive to give them access to the facility. Floor plans should also be available for the risk assessor to review while on site. And finally, your facility can remain open during the on-site visit, but local areas may need to be restricted at the discretion of the risk assessor. Now that we have covered a brief overview of the lead-based paint section, we will review how to complete the online enrollment survey in more detail. When you log into your facility dashboard, you can see the progress for each section of the program, including lead and water, lead-based paint, and asbestos. Throughout the process, you can view your facility's progress through the program. A green check mark indicates the step is completed. To the left, you can navigate through the menu and view the facility team, which includes all members that have created an account in the portal for your facility. After watching this video, you will see a green check mark next to the lead-based paint section training step, indicating you have access to the lead-based paint enrollment survey. The enrollment survey includes 7 different sections: welcome, building information, student demographics, lead-based paint questions, renovations, document upload, and finalize. All questions throughout the survey are required to be answered before you can submit your survey for our team to review. If any information is missing, you'll be directed to fix the issue prior to submitting. If the lead and water or asbestos enrollment surveys have already been completed, the responses will auto-populate for the welcome, building information, and student demographic sections. The primary contact is responsible for reviewing all auto-populated information. It is important that the information is carefully reviewed for accuracy because the responses will affect other questions in the enrollment survey and ultimately next steps for the facility. Once you've completed each section, you'll be directed to finalize your survey. You can sign out and come back to complete the survey at any time. However, you will need to save your progress on each page. In the welcome section, you can add any staff who should receive email notification updates about your facility's progress through the lead-based paint section of the program. You may add staff who have not logged into the portal, but if these staff would like to view or edit your facility's enrollment survey, they must attend the pre-enrollment webinar and create an account to log in. You will also be able to designate the primary contact for the lead-based paint section. The physical address we have on file for your facility will already be listed when you begin the survey. You may add additional addresses or modify existing addresses and can indicate the address type, such as physical or billing address. It is required that each facility list at least one physical address. After the welcome section, you will be directed to enter building information, including the school type, approximate size, age of building, and schedule of operations. In the question about building age, you will need to list out individual buildings and the year built. It is very important that you provide accurate information for the age of each building at your facility, because the state rule allows for building age exemption if all of a building was built after 1978. If you do not know the year built, you'll be asked to enter a range. You will not qualify for the building age exemption if a range has been entered. In the student demographics section, you'll be asked to fill out the number of students enrolled during the last year, the percent eligible for free and reduced lunch, and the percent of students by race and ethnicity. After the student demographics section, we'll begin the lead-based paint related questions. During the building information section, if you entered that all buildings at your facility were built after 1978, your facility may qualify for the building age exemption. If you indicate the superintendent or superintendent's designee can sign the attestation that states no lead-based paint was used in any buildings, you will be skipped to the end of the survey to upload the signed attestation and are not required to complete the remainder of the survey questions. If district staff are completing the enrollment survey for multiple facilities in the school district and would like to attest that multiple facilities built after 1978 did not use lead-based paint in any of their buildings, the district personnel can add each of these facilities to the same signed attestation. When the attestation is uploaded for the first time, the district staff will be instructed to choose all the facilities listed in the portal, which will link the document to each facility's enrollment survey. The attestation will not need to be re-uploaded for the listed facilities. However, the other sections of the enrollment survey will still need to be completed. Our team will review the attestation to determine if the listed facilities can be exempt from the lead risk assessment requirements. Here's a diagram of how building age exemption works for a new facility. If all buildings at the facility were built after 1978, we will have the option to indicate whether or not the superintendent or superintendent's designee can attest that no lead-based paint was used in any buildings. If you indicate your facility can attest no lead-based paint was used, we will skip to the end of the survey where you'll be provided a template attestation for your facility to complete and sign. If district staff are completing the survey, they can choose all the facilities listed on the attestation, so they will not have to re-upload the attestation for each facility survey they complete. Attestations should only be signed if the superintendent or superintendent's designee is certain that all buildings were built after 1978 and no lead-based paint was used in any of the buildings. During the building information section, if you entered that some of the buildings at your facility were built after 1978, these specific buildings may qualify for the building age exemption. If you indicate the superintendent or superintendent's designee can sign the attestation that states no lead-based paint was used in these buildings, you'll be asked to upload the signed attestation at the end of the survey. However, your facility is still required to complete the remainder of the survey questions for your pre-1978 buildings. Our team will review the attestation to determine if the listed building can be exempt from the lead risk assessment requirements. Here's a diagram on how building age exemption works for new buildings. If some buildings at the facility were built after 1978, you will have the option to indicate whether or not the superintendent or superintendent's designee can attest that no lead-based paint was used in these buildings. If you indicate your facility can attest no lead-based paint was used, you will be provided a template attestation for your facility to complete and sign at the end of the survey. Attestation should only be signed if the superintendent or superintendent's designee is certain that the specific building was built after 1978 and no lead-based paint was used. Facilities where not all buildings were built after 1978 or they do not upload a signed attestation will need to complete the remaining lead-based paint survey questions. We ask whether your facility has already been assessed by a certified lead professional to determine whether lead-based paint hazards are present in your building and whether this assessment occurred within the past 3 years. Do not include assessments conducted by uncertified professionals using lead test kits. You'll be asked to upload or mail your assessment report to the Clean Classroom for Carolina Kids program. If you indicated your facility has already been assessed for lead-based paint, you'll be directed to add an assessment record from the most recent assessment at your facility. You will need to provide the assessment date, whether the whole or partial facility was assessed, the name of the certified lead professional, and the company that performed the assessment. You will also be asked about mitigation or abatement activities that were performed to address any lead-based paint hazards that were identified during the assessment. If this applies to your facility, you'll be asked to upload or mail the mitigation or abatement records. We also ask whether your facility already has plans to mitigate or abate any lead-based paint hazards within the next 3 years. We will also ask you about any areas in your facility where you are concerned about lead-based paint exposure, such as chipped or peeling paint. If you do have any concerns about lead-based paint exposure at your facility, please be sure to describe them. For example, peeling paint in a classroom or chipping paint into soil on the playground could be of concern. The last question in this section asks whether you would like to request a specific certified lead professional to work with your facility to review your provided documentation and perform an on-site visit as needed. You'll have the option to select your preferred company and whether you would like to be assigned to a different company if your preferred company is unavailable. We cannot guarantee that your preferred company will be assigned to your facility given the volume of work in this program, but we will prioritize previously established working relationships between facilities and companies. The next section is on past and planned building renovations. Facilities that have gone through major renovations since their most recent assessment may require additional sampling during an on-site visit, if one is needed. If you indicate your facility has an upcoming renovation, your facility may be prioritized to receive an on-site visit as needed. The document upload section will direct you to upload any documents you indicated were available for electronic upload throughout the enrollment survey. PDF document type is recommended. Please ensure that all documents you upload are legible, right side up, and complete. When you upload a document, the file will be renamed using a standard format to allow for document tracking. At the end of the survey, you'll be shown a summary page that lists what documents you uploaded and which documents you indicated you'll be mailing to our program, along with mailing instructions. We strongly recommend that documents are electronically uploaded, if at all possible. Facilities that upload their documents will be prioritized in the program. Mailing documentations will significantly delay your facility's progress through the program. However, if documents must be mailed, please mail a copy and retain the originals, as mailed documents will not be returned. We will also indicate what your facility can expect next. Once you have finished the questions and any uploads, you're ready to submit your enrollment survey. You'll be notified if any information is missing, and you can easily jump back to that section to fix the error. You will need to certify that all documents are authentic, complete, and they were uploaded in full before clicking the Submit Enrollment Survey button. Please note that all documents must be electronically uploaded to the online portal or mailed to the Clean Classroom for Carolina Kids program to meet the state requirements for an exemption from the required risk assessment. Documentation should not be sent directly to the state. Once your facility has completed the enrollment survey and uploaded the necessary documents, our team will review your responses to determine next steps within the program. Remember, at any time you can log in and view your facility dashboard to see the facility's progress through the program. In this section on enrollment survey review, we will discuss the potential next steps for your facility. After our team reviews your enrollment survey, the next steps may be a facility exemption or an on-site visit, which could include a lead risk assessment or a site verification. We will walk you through each of these and when each one could occur. An exemption from the rule requirement means that your facility does not need an on-site visit for a lead risk assessment or site verification. There is a building age exemption and a prior assessment exemption. Facilities where all buildings were built after 1978 may be exempt if they provide the signed attestation that states lead-based paint was not used in any buildings. If the facility provides a signed attestation for only some of their buildings, they may still need an on-site visit for the other pre-1978 buildings. Facilities may also be exempt if they provide documentation of a lead risk assessment conducted within the past 3 years. This lead risk assessment must meet all rule requirements and either have identified no lead-based paint hazards or any lead-based paint hazards that were identified must have been addressed. Documentation associated with these exemptions must be provided to the Clean Classroom for Carolina Kids program in order to meet the rule requirements for exemption. If your facility is exempt, then lead-based paint section is complete. No additional action is needed by the facility. The first on-site visit option we will cover is the lead risk assessment. Your facility will need a lead risk assessment if 1, your facility has not been assessed for lead-based paint hazards, 2, your facility was built after 1978 but cannot provide the signed attestation that states no lead-based paint was used in the buildings, or 3, your facility was previously assessed for lead-based paint, but the assessment was not within the past 3 years, does not meet the rule requirements, or no assessment documentation was provided to our program. In all of these cases, our team will assign a certified lead risk assessor to perform your facility's risk assessment. Later in this video, we will let you know what to expect and how to prepare for all on-site visits. The other on-site visit option is a site verification. A site verification means a certified lead risk assessor will need to visit the facility to verify the conditions of specific lead-based paint hazards. Site verifications may be required if the facility had a lead risk assessment that meets all rule requirements within the past 3 years, but there's no documentation that the lead-based paint hazards that were identified have been addressed. As with the lead risk assessment, our team will assign a certified lead risk assessor to perform your facility's site verification. Now that we have overviewed what potential next steps may be after our team reviews your facility enrollment survey, we will move on to what happens if a certified lead risk assessor is assigned to your facility for an on-site visit. In this section, we will review what your facility can expect during an on-site visit and how you can prepare. If an on-site visit is needed, our team will first assign a certified lead risk assessor to your facility. Once assigned, the certified lead risk assessor will communicate with the primary contact to schedule the date and time for that on-site visit. The certified risk assessor will perform the scheduled on-site visit. They may begin by having you complete a survey to collect information on potential lead-based paint hazards. Then they will perform a visual inspection to locate any deteriorated paint, assess the extent and cause of the deterioration, and identify any other potential lead-based paint hazards. The risk assessor will also perform an assessment of the exterior and interior surfaces of the buildings and any outside areas using a portable XRF instrument, which is a real-time analyzer that can identify the amount of lead present in seconds. If needed, the certified risk assessor may collect samples of paint chips, dust, and/or soil to be analyzed by the RTI Environmental Lead Laboratory. And finally, all results and recommended actions will be made available to your facility in the portal. You will be notified by email when your results and reports are ready to review. The primary contact also has a key role when it comes to preparing for the on-site visit. They should be available to schedule the date and time of the on-site visit when the certified lead risk assessor reaches out to your facility. The primary contact should also plan to meet the certified lead risk assessor when they arrive at the facility to grant them access to conduct the on-site visit. Lastly, the primary contact should have your facility's floor plans available for the certified lead risk assessor to review during the visit. On-site visits can occur during normal hours, after hours, on weekends, or during breaks. Facilities can remain open during the on-site visit. However, local areas may need to be closed at the discretion of the certified lead risk assessor. On-site visits are estimated to take between 1 to 3 days, depending on the size of the facility. During the on-site visit, samples may be collected and submitted to the RTI Environmental Lead Laboratory for analysis. Once the laboratory analysis is complete, the certified lead risk assessor will write a results report and provide recommended response actions. The facility will then be notified by mail to log into the portal and view the results and the recommended next steps. This final section will cover results and recommended actions for your facility. If no lead-based paint hazards are identified by the certified lead risk assessor during the on-site visit, no additional action is required by the facility. As defined by the rules, a lead-based hazard is any lead-based paint, lead dust, or lead in soil that is above the state action levels and is likely to result in exposure to lead. Properly managed lead-based paint is in good condition is not considered a hazard under this program. There is no requirement to restrict access to or mitigate lead-based paint that is in good condition. However, if lead-based paint hazards are identified, the certified lead risk assessor will recommend different response actions depending on the condition and type of hazard, such as a paint, dust, or soil hazard. Recommended response actions may include mitigation activities such as interim controls, abatement, or renovation, repair, and paint, also known as RRP activities. The facility is required to restrict access to the hazards until it is mitigated. If the facility chooses not to mitigate, they must restrict access to the hazards indefinitely. Your facility results and recommended response actions will be available on the results view of the portal. You'll be able to easily view any lead-based paint hazards identified at your facility, as well as the full report and sample results. Additional videos and resources will be available to help you understand your results, report, and pursue mitigation activities if needed. Your facility's results will also be posted to our Facility Data Mapper, which is designed for facilities and the community they serve to view the results. The Facility Data Mapper provides a way for the facility to easily communicate the results of the program to staff, parents, caregivers, and students, whether the facility received an exemption from a lead-based paint exemption, or if any lead-based paint hazards were identified, and any mitigation activities that were performed. The results and report will be automatically posted to the Facility Data Mapper 5 days after the results are shared with your facility. You can use this time to restrict access to any identified hazards, create communication materials to keep your community informed, and make a plan for mitigation action as needed. Since lead and water mitigation is provided by the Clean Classroom for Carolina Kids program, this information will be readily accessible to the community through the Facility Mapper, and the public will be able to see the actions taken to get the lead out of the tap. However, lead-based paint mitigation activities are not provided by our program and will not appear in the Facility Data Mapper unless the facility lists the actions taken in the portal. Facilities should indicate whether access was restricted or the hazard were mitigated and upload clearance documentations in the portal once the mitigation or abatement activities are completed so the public can be aware of the actions your facility took to eliminate lead-based paint hazards where children learn and play. We also provide resources to help you share information with your community. The program communication toolkit includes template for notification emails, draft newsletters, talking points, and social media tiles. We also provide reference documents that you can share, which includes program overview flyers and flyers on understanding the program and rule requirements and flyers on understanding on-site visits. All documents are available in Spanish and English. We encourage you to communicate early and often about your facility's participation in the program, including enrollment, any on-site visits, results, and next steps. After reviewing the results and recommended actions, the facility will decide whether to restrict access to any identified hazards or to pursue the recommended mitigation or abatement actions. Facilities that perform mitigation or abatement can request reimbursement from NCDHHS. It is important to note facilities are responsible for deciding on any mitigation or abatement activities and scheduling those activities. While the cost of on-site visits and sampling are coordinated and completely covered by our program, mitigation activities are not. Schools must match cost at $1 for every $2 as funding is available and requirements are met. Child care centers within schools have no cost match requirement. Please note that mitigation activities should be scheduled when the facility can be mostly unoccupied. Depending on the size of the mitigation area, the timeline can vary. You can visit the North Carolina Department of Health and Human Services website by following the link or using the QR code on this slide for more information on reimbursement and covered mitigation activities. Now that we've finished reviewing the steps for the lead-based paint section, we'll briefly review some frequently asked questions. First, will my asbestos and lead-based paint inspection be scheduled for the same day and time? Our team will make every effort to minimize the number of on-site visits at your facility, but scheduling both the asbestos and lead-based paint inspection for the same day will depend on the availability of the certified/accredited professionals and the size and location of the facility. Not all professionals are certified/accredited to assess both lead-based paint and asbestos, so different professionals or companies may be scheduled to your facility if you need both a lead-based paint and asbestos on-site visit. Next, if my facility requires an on-site visit, when can I expect the certified lead risk assessor to complete the lead risk assessment or site verification? Your facility will be notified when a certified lead risk assessor is assigned for an on-site visit. They will have 5 business days to contact your facility to schedule a date and time that works for you and the certified lead risk assessor. Another common question: how long will the on-site visit take, and can the facility still be open during the on-site visit? The on-site visit largely depends on your facility size, but typically they range between 1 to 3 days. Your facility can remain open during the on-site visit, but local areas may be restricted at the discretion of the certified lead risk assessor. And last, how do I communicate the results to our community? You can direct staff, parents, caregivers, students, and others to our facility data mapper, where they can view the lead-based paint reports and results for your facility. Please see our program's training and resources page for program-specific information on communicating with your community regarding the facility's on-site visit results. Thank you for helping us identify and eliminate lead and asbestos hazards where North Carolina children learn and play. You may now continue to the asbestos enrollment survey. Thank you for helping us identify and eliminate lead and asbestos hazards where North Carolina children learn and play. You may now continue to the lead-based paint enrollment survey to complete the questions and upload any applicable documentation. If you have any questions, please contact our team using the QR code or website link on this slide. You can also call or text us at 1-855-997-2864 or visit our FAQ page. The Clean Classrooms for Carolina Kids team is here to help you throughout this entire program.